Welcome to this training program, How to Educate Clients About the Benefits of Healthy Timing and Spacing of Pregnancy. I am your moderator, Olivia Smith, and I will be guiding you throughout this program. Healthy Timing and Spacing of Pregnancy, or HTSP, is an approach to family planning service delivery that focuses on the healthiest time to become pregnant and the healthiest spacing between a birth and the next pregnancy. HTSP messages appeal to clients because they place family planning in the context of promoting healthy pregnancies, healthy mothers, and healthy babies. Clients' understanding of these HTSP messages can increase their acceptance and use of family planning services. This program was developed for use by family planning health providers and for maternal, neonatal, and child health providers at all levels of healthcare. It should be used as a part of a training program in conjunction with the HTSP Trainer's Reference Guide and other reference materials included with this program. The program may be used in group training or in individualized self-study. This program has 3 main sections. In Section 1, Dr. May Post explains more about what HTSP is and describes its foundation in scientific research. Also in Section 1, I give an overview of the counseling scenarios that follow and offer suggestions about what to look for in each one. Section 2 is the heart of the program. Here there are 3 counseling scenes focusing on clients at different stages of their reproductive lives: a young pregnant woman, a 32-year-old woman who has had a miscarriage, and an adolescent thinking about her future. In Section 3, Dr. May Post answers frequently asked questions about healthy timing and spacing of pregnancy. And then I conclude the program by reviewing the HTSP messages. After viewing each part of this program, you may use the program menu to select the segment that you want to view next. We hope this program will improve your ability to help your clients make informed choices that will improve their health and the health of their children and families.
I'm Dr. May Post, and I'm the Senior Advisor for Reproductive Health and Family Planning at the Extending Service Delivery Project. HTSP stands for Healthy Timing and Spacing of Pregnancy. Health providers have heard about birth spacing for many years. Birth spacing is a general recommendation where the health providers tell women, space your births 2 years apart. In general, they are talking about a birth-to-birth interval rather than a birth-to-pregnancy interval, which is HTSP. HTSP, like birth spacing, is an approach to deliver family planning services. HTSP refers to the healthiest time to become pregnant rather than when to give birth. HTSP recommends that a woman wait 24 months or 2 years after a live birth before thinking about the next pregnancy. This is to ensure healthy pregnancies, healthy mothers, and healthy babies. In addition, HTSP recommendations are evidence-based. The evidence came from a series of meta-analyses and literature reviews sponsored by USAID, where the researchers looked at nearly 200 studies, and they found that short pregnancy intervals have adverse risks for the mother and the baby. For the mother, she will have increased risk of maternal mortality, a miscarriage, or an induced abortion. The baby will have increased risk of being born early, preterm birth, low birth weight, small for gestational age, a stillbirth, or infant and neonatal mortality. USAID submitted the studies to WHO, where technical experts reviewed the findings and concluded that short pregnancy intervals were indeed associated with increased adverse risks for the mother and the baby. Based on their conclusions, the experts came up with 2 recommendations. 1, to wait 24 months after a live birth before attempting the next pregnancy, and 2, to wait at least 6 months after an abortion or miscarriage before attempting the next pregnancy. USAID added a 3rd message aimed at reaching youth based on recommendations made by WHO, UNICEF, and UNFPA related to early age pregnancy, that adolescents should delay their first pregnancy until they are at least 18 years of age.
We now present 3 counseling scenes. Each scene takes place in a distinct healthcare setting and culture, representing the range of settings in which HTSP messages may be applied. Scene 1 is set in an antenatal clinic in Pakistan. Scene 2 takes place in a Nigerian hospital after a miscarriage. Scene 3 is a home visit by a community health worker in Kenya. Although the settings in all the scenes might not look like what you're used to, the issues confronting the clients and the concerns addressed by the providers will undoubtedly be familiar to you. After each of these scenes, I will review highlights of the scenes and repeat the HTSP message of that scene. There are several things you should look for while viewing each of these counseling scenarios. First, look for how the provider picks up on clues from the client to introduce the HTSP message in a way that makes it a natural part of the conversation. Second, check to see how the provider tailors the HTSP message to the client's specific needs and emphasizes benefits that are most appropriate for that client. Third, look for the examples of good counseling technique that each provider demonstrates. Things such as communicating warmth and respect, using language appropriate for the client, asking one question at a time, and giving accurate, clear information. After you have viewed each scene, you may want to stop the program and, along with other participants in the training, assess the quality of the counseling session and how the HTSP message was delivered before watching the review of the scene. Please use the program menu to view Scene 1 or to select another segment of the program that you want to view